someone in the UK is diagnosed with cancer about every 90 seconds. Become familiar with your poo people. It's normal, it's not rude, it's not dirty. Your body made it, it's yours. Look at it.
There's that short-term discomfort for potential huge gain for picking something up early.
It's never too late to change your lifestyle.
What's done is done, but what goes forwards is down to you.
I know lots of men are worried about having their prostate checked because they don't want to have the physical exam.
The finger up the bum. We're talking about the finger up the bum. They don't want to have that. Hi and welcome to Inside Health. In this episode, we'll be exploring how you can take steps to get ahead of cancer. According to Macmillan Cancer Support, on average, someone in the UK is diagnosed with cancer about every 90 seconds. And more people are getting cancer at a younger age. Now, these are scary statistics, but there's some good news too. By being more aware of what to look out for and understanding how to reduce our risks, we can actually make a massive difference. For example, in the case of bowel cancer, diagnosing the disease early can increase 5-year survival rates 8-fold. So today I'm joined by two brilliant experts as we go through the best things that you can do to get ahead of cancer. Coming up, we'll be looking at how you can spot the early signs of cancer, what to expect from your regular screenings, with a bit of reassurance as well on some of the worries that you might have about that, some lifestyle steps that could help reduce your cancer risk, and finally, we'll be answering your questions in our Q&A. So if you do have any questions for us, please do put them in the chat. We'll be keeping an eye out and we'll be answering as many as we can. So let's get started then by looking at the symptoms of cancer. To help me, I have the wonderful Dr Tim Woodman here. Tim is the Medical Director for Policy and Cancer Services at Bupa and a member of the European Society for Medical Oncology. Thanks for joining me, Tim.
You're welcome.
I think it's probably fair to say that most people aren't totally aware of all of the things that they need to be looking out for when it comes to cancer. In fact, I've got a worrying statistic here that more than 1 in 3 people can't name a single symptom of bowel cancer. But it's really vital that we do get informed and we have this knowledge. Knowledge is power, so that we can identify and spot things early, isn't it?
I think that's absolutely true. And there are a vast number of symptoms that could potentially mean you've got cancer, probably mean you haven't. So if you're looking at things like feeling abnormally tired with no obvious reason, losing weight when you've not been trying to, aches and pains that don't go away and aren't related to exercise, bleeding when you shouldn't be bleeding. Now that may be cyclical bleeding if you're a woman, or it may be bleeding in your poo or in your urine. Odd feelings of fullness and bloating, sweating at night, anything that's not normal for you, really you need to get checked out.
It can feel like quite a lot of things to remember, isn't it? So, but it is, like you say, the current theme of everything you were saying there is it's a change that doesn't seem quite right. Get it checked out.
Yeah, I mean, I always say, know yourself. Don't get totally obsessive about it, but you should know what's normal for you.
Yeah.
And if it's not normal, don't be afraid to ask.
So let's take a look at some of the more specific cancer symptoms. In the UK, the so-called Big Four are the most commonly diagnosed cancers, and that's bowel, lung, breast and prostate. So is it okay to go through them in order and have a look at what some of the specific signs are, starting off with bowel cancer?
Definitely. Yes, I mean, bowel cancer is becoming increasingly common and we're seeing it more in younger people. So I think it's very important to be aware of the signs. Again, it goes back to what is normal for you. So if you find that the way you go to toilet has changed in some way, either you feel you need to go more often, you actually do go more often, you pass blood when you poo, or your poo becomes harder and more difficult to pass. But also if you start to get pain down lower in your abdomen, or you feel bloated, anything like that, you really ought to get checked out.
Okay, become familiar with your poo people. It's normal, it's not rude, it's not dirty, it's your body made it, it's yours. Look at it. What about lung cancer? What should we be looking out for there?
Lung cancer is a difficult cancer for people to treat because it often presents late, because people that smoke, they cough. A cough that doesn't go away is a cough that needs looking into. So if you've had a cold or the flu, but you've still got a cough after, say, 3 weeks, get it checked out. If you've had a chest infection and you've had antibiotics and this still hasn't gone away, get it checked out. Even more so, obviously, if you've ever smoked or you're still smoking. If you have a cough and you ever cough up any blood, that's really important to get checked out. And again, the general things like losing your appetite and losing weight when you shouldn't. And another thing with lung cancer is people often find they sweat at night for no obvious reasons, and that's something that you really need to get looked at.
And like you were saying, often the symptoms don't appear till quite late. So anything, it's just always, if you're not sure, it's always better to just get it checked out sooner rather than later, isn't it?
Absolutely.
What about breast cancer then? So according to Breast Cancer Now, almost half of women in the UK aren't regularly checking their breasts for potential signs of cancer. So what should women be doing? And is it just about looking for lumps, or is there more to it?
There's definitely more to it than lumps, but when it comes to looking at lumps, it's very important that you learn how to do it. So really get some advice from a health professional or a nurse. When you're next at your doctor's surgery, ask if you can see somebody there and be taught how to properly examine your lumps. Because, again, you need to know what's normal. You need to know what's the best time in the month to examine your breasts as well, because they change over time. But it's not just about lumps. It can be changes in the skin. If the skin gets drawn in or puckers up, or you get a rash that doesn't go away, particularly if it's a rash around the nipple, and if the nipple itself changes and gets pulled in or twisted out of shape, any of those things you definitely need to get checked out. And remember, your breast extends into the armpit as well, so similar signs in your armpit also need to be checked out.
And men need to check too, because men can get breast cancer as well. So check your breast, check your chest.
Absolutely, yeah.
Okay, so whilst the lump is always what springs to mind, it's really important people remember any change, really. Get to know you're normal. Anything changes, check it out. How about prostate cancer? I read a stat that almost half of men don't know where their prostate is, and some don't even know that they have one. So let's clear that up. Where is the prostate, and what's a sign, or what are the signs that something's not quite right?
Okay, so the prostate is a little gland which people all say it looks like a walnut, and it's the size of a walnut. It sits just below the bladder, and it's wrapped around the urethra, which is the tube through which the urine and the semen passes. So, as you'd imagine, anything that goes wrong with your prostate may start to affect those two body symptoms. As you get older, your prostate gland gets bigger anyway, so it can press on the bottom of your bladder, and you may feel that you need to pass urine a little bit more than normal, particularly at night. Similarly, it can squeeze the tube out of the bladder, so you might find it slightly harder to go. But if those symptoms start to get severe, so if you find you're getting up 6 times at night for a pee and you haven't been on the beer all evening before, it's really important to get that checked out. If you find that you can't start peeing properly, but once you get going, it's not as strong as it used to be, and you can't stop at the end of it, or you dribble a bit and you find you're getting a little bit incontinent, that again needs to be checked out. Similarly, if you ever spot blood in your urine, that needs to be checked out. Now, as I said, it also affects the flow of semen. So you may find if you get blood in your semen when you ejaculate, that's a definite red flag to get checked out. And sometimes if the prostate gland is getting particularly large, it can actually cause difficulties getting an erection. So again, that's something that's worth getting checked out.
Okay, great. Thanks for sharing that. So we've covered the most common types of cancer there, but are there symptoms of more unusual cancers that often slip under the radar?
There are several cancers that don't get detected early because the symptoms can be quite vague. Now, in particular, esophageal cancer, so that's the bottom of the gullet where it joins the stomach. That often presents with heartburn, but lots of people get heartburn. But if you find you're getting food sticking and it's getting difficult to swallow things, get that checked out. Again, if you find you're losing weight, get that checked out. If the heartburn doesn't go away with simple medications, it needs to be looked at. The second cancer that we find problems with diagnosis is cancer of the ovaries, because actually your ovaries are quite small, they're well buried inside you. They often don't produce any kind of symptoms until it's quite late, and those symptoms are because they've got bigger. So you'll get abnormal swelling in your abdomen, you'll feel bloated, younger women may start to notice difficulties with their periods, and sometimes with ovarian cancer, it can even start to affect the bowels. So again, if you get any symptoms like that, if it's not normal for you, get it checked out. And the third one, which is a cancer where we really haven't made much progress at all in the last 10 years, is pancreatic cancer. That's often diagnosed very late because, again, it's an organ that's hidden deep in your body. But pancreatic cancer can be treated if it's found early, as with many cancers. The symptoms of pancreatic cancer, typically, it's pain in the abdomen, it's pain that goes through to your back. It absolutely doubles you up. You may find that your urine starts to get a bit dark, your poo gets a bit pale, or your skin and the eyes start to go a bit yellow, you start to get jaundiced. Those are all really worrying signs that you need to get checked out.
Okay, great. I mean, it's a lot of information, isn't it, when we look at it like that? So I wonder if you can somehow summarise for us, or if people remember one thing today, what would you want it to be?
If people remember one thing, it's just know you're normal, know yourself, and just be alert for any changes in that.
Okay, that's great. Thank you so much, Tim. So there you have it. If you want any help remembering those symptoms, because there were quite a lot, you can find them all on the cancer information page on the Bupa website. And we'll also pop a link in the chat. And if any of those symptoms sounded familiar to you, please, please, please do book an appointment with your GP. Bupa customers can access digital GP appointments 7 days a week via the My Bupa app. So no excuses. Do it right now. As we said earlier, there's every chance it's nothing, but if it isn't, it's far better to know and take action sooner. Right, now that you've learned how to check in with your body, it's time to focus on how you can check up on your cancer risk through testing. And I'm really happy to introduce Dr Frankie Jackson-Spence. Thank you so much for joining us, Frankie. She's joining me and Tim to explain what to do and what to expect if you receive a test or an opportunity for screening. And we'll all be invited for screening via the NHS at some point, so this is relevant to everybody. Frankie is a medical doctor and a clinical research fellow in oncology at Bupa Health NHS Trust. And she's doing her PhD at Queen Mary University in London. Plus, she's also a very committed social media advocate for cancer and health awareness. So thank you for joining us, Frankie. I think sometimes there can be a bit of confusion around some of the language around cancer detection. So first of all, would you mind sort of helping us understand the difference between cancer screening and then testing for cancer?
Absolutely. So screening is usually part of the NHS screening programme, where everyone over a certain age that's registered with a GP without any cancer symptoms are invited to have some tests or investigations, maybe even a scan, to pick up cancer that they may not know they have. And this is very different to people who have symptoms, go to the GP with them, and then invited for further investigations to pick up a cancer or pick up something else that has a similar symptom. So they're very different. Screening is for people without symptoms, and cancer investigations or tests are for people who have symptoms.
Thank you. That's really, really clear. Thanks, Fred. And sometimes even you think about cervical screening, we're not even looking for cancer, we're looking for pre-cancerous changes, are we?
Exactly.
I think people get quite frightened by screening. So how is cancer usually caught? Is it through self-checking and people going to their GP, or is it more often detected through a screening programme, or is it a bit of both?
A bit of both. I think most cancers are picked up from the GP. It's usually a symptom, and the person may not have even gone to the GP thinking they have cancer. It could be a symptom of something else. Yeah. And we have kind of a list of symptoms in our head that Dr Tim kindly went through that are red flags for cancer. And if you have one of those symptoms, you're referred on what we call the urgent suspected cancer referral pathway. It used to be called the 2-week wait pathway for further tests or to be referred to a cancer doctor. Sometimes, and the majority of people who were referred on that pathway don't actually end up having cancer, but it's still important to go through those investigations. And that's the majority of cancers. Some people go to the GP thinking, I've got cancer, or they've done a self-check and they think something's not quite right and absolutely should go for that. I think reassuringly, for the majority of people that go when they've done a self-check, it turns out not to be cancer. And that's what people are always really worried about. But it's always best to go and get that reassurance.
Yeah, absolutely. I think people are afraid, aren't they? I know a lot of people will identify a change and then they won't go and see a healthcare professional because of that fear of finding out potentially that it is cancer. But as you said, the vast majority of people who come forward with those concerns, it turns out it's not cancer. So, there's no point worrying twice, no point worrying, because if you do find out and it is cancer, you're going to worry at that point anyway, aren't you?
Yeah.
Just don't worry twice. There are 3 main cancer screening programmes in the UK, so breast, cervical cancer and bowel cancer, and lung cancer screenings are also being trialled in some parts of the UK. So could you tell us a little bit, first of all, about breast cancer screening?
Absolutely. So breast cancer screening, people might know it as mammograms, and this is where any female registered at a GP will be invited to have a mammogram, which is an X-ray of the breast tissue. You're usually invited within 3 years of your 50th birthday, and they happen every 3 years until age 71. And you basically go in and have X-ray images of the breast tissue, and it can help pick up any lumps or any changes that you may not have noticed, like early cancers or deep cancers that you may not have been able to feel or detect on your self-examination.
Okay. I know a lot of people worry about going and a lot of people fear that it's going to be painful. Is it painful?
So I think let's talk through what actually happens in a mammogram. So basically you go in, it only lasts a few seconds. You'll be asked to undress from the waist up in a privacy screen, and then you'll be invited to come and your breasts will be placed in the X-ray machine. It's basically the breast tissue is compressed between 2 plastic sheets, and that can be uncomfortable, but it does only last a few seconds. And I think it's important because it's that short-term discomfort for potential huge gain for picking something up early. The machine takes 2 types of images. So it'll first be at the sides and the breast will be squeezed, and then it flips around and takes images on the other side so that we get images of the breast from all different angles. And if there is anything there that you might not have been able to feel, then that will be picked up. And then that lasts a few moments. You'll be asked to get dressed again, and then it's done, and you can put it out of your mind for a few years.
Okay. In and out. It's worth it for a few seconds of discomfort. Come on, guys. Something that could save your life.
And I think if someone does have a particularly tender breasts, you can, of course, take some over-the-counter pain relief before you go. Of course, share your concerns with your practitioner that's going to do it so that they can, understand that you're worried or that you have discomfort, and take someone with you for support.
Yeah. Okay. Thanks for that. So what about cervical cancer then? We know that screenings make a massive difference here. In fact, in 2040, we may be able to completely eliminate cervical cancer in the UK, mainly thanks to the government screening programme combined with the HPV vaccine, which is incredible. So what are they actually checking for in a cervical screening?
Okay, so cervical cancer screening used to be called the smear test. Many people know it as that. And anyone with the cervix who's registered at the GP will be invited from age 25. And it's actually changed recently. It used to be every 3 years in England. It's now going to happen every 5 years. You basically go to your appointment. You get asked to undress from the waist down. They put a sheet over on top of you, and then you lay on a bed, and they will insert a lubricated plastic tube called a speculum to have a look at the cervix, and a small brush is inserted to take a couple of cell samples. Now, what's interesting about cervical screening is not actually a test for cancer. What we're trying to pick up is something called the HPV virus, which stands for human papillomavirus. And that's because this virus is responsible for the majority of cases of cervical cancer. And so, first of all, on your sample, they check for that virus. If you have that virus, they then check if there's any abnormal changes in the cells of the cervix. And if there are, then you'll be invited for some further investigations just to look at the cervix more closely. One thing I really want to caveat here is that anyone who's sexually active probably will get the HPV virus at some point in their lives, and our immune system naturally clears it within a couple of years. So having HPV detected on your cervical screening is nothing to worry about.
Yeah, because a lot of people, they get that and they freak out. They think, what does this mean?
They think it's a sexually transmitted infection, and there's a lot of stigma associated with it. But everyone will get that virus. The issue is that some people have a particularly high risk strain of HPV, and that's they're the ones that can cause cervical cancer, or there's something different about their immune system, which means they don't clear it. And if you don't clear the virus over a number of years, cancer can develop. But the takeaway message is that cervical screening is over really quickly, and it is detecting any pre-cancerous changes or just the presence of the virus. It's not a test for cancer.
Now, a lot of people worry about it being uncomfortable or being painful. I sometimes liken it to a wax. Yeah. If you go and have a wax, you can guarantee that is more painful, it takes more time, and that person doing the wax has to get in there much more than your doctor or nurse does doing a cervical screening. So
yeah.
If you can manage a wax, you can more than manage a cervical screening without problem. But people who anticipate that it will be difficult for them for whatever reason, whether it's mobility issues or whether they have any problem whatsoever, I always say just have a chat with your GP, because it's always a way that we can make it easier for you.
Yeah, I think it's uncomfortable rather than painful for most people, and there are ways to reduce the discomfort. I think if you're tense and awkward and stressed about it, it makes it worse because all the muscles are contracting. So I always advise people to take a big breath in and then as you breathe out, all your muscles relax, and then they can insert the speculum. If you are particularly nervous, you've had a bad experience, or some women do have more pain, then if you share that with the nurse or doctor doing the procedure, then they can take a bit more time. You can do some deep breathing. They can use a smaller speculum. Again, you could take some simple over-the-counter painkillers. But there are ways to make it less unpleasant. And again, it is over really quickly. Often the fear of doing it is much worse than it actually happening.
Yeah. So just to give anyone who's a bit worried that extra bit of reassurance, I've seen this on the chat. Jodie says, I remember I was so nervous for my first cervical screening appointment. I took my mum with me, but it really wasn't so bad in the end. Way worse in my head. So just like you were saying, often, our own fears of it are much worse than it happened. And again, it's something that could save your life. Moving on to bowel screenings, who are those for and what's involved?
Bowel screenings are a little different because it happens at home. So everyone over the age of 50 will be sent the bowel cancer screening test in the post. It's called a FIT test. And people get a little bit embarrassed about that because, again, it involves you looking at your poo. So it is a test called the FIT test, which is designed to detect any traces of blood in the poo that are so small you couldn't see it. So again, people that don't have symptoms will be doing this test. You basically are asked to poo into a container. You then take a little sample of your poo, pop it in the sample box, and then send it off in the post. And it will be checked in a lab for the presence of any blood. It's really important to point this out because lots of people say, well, I don't have blood in my poo. Sometimes there can be a really small amount that's not visible to the human eye, or the blood can be a little bit digested and it's actually brown, so you can't see it visibly. So even, especially if you don't have symptoms, it's important to engage with this. And that happens every 2 years until around age 75.
Okay, so specifically what they're looking for in your sample is those just slight traces of blood that otherwise you might not detect. And if you do have some blood, if it is positive, absolutely doesn't mean you have bowel cancer. It just means they need to consider if you need any further tests to look into it further.
Exactly. In most cases, if they do find blood in the poo during this test, it doesn't actually turn out to be cancer. There's lots of reasons we can have blood in our poo. But what it does mean is that you'll be invited to have an appointment with your GP and potentially referred for some further examinations like a colonoscopy, where they look directly in the bowel just to make sure nothing's there. And if it does turn out to be cancer, then of course it's so much better to have picked that up early because their outcomes are so much better.
Yeah, some actually really, really, really good outcomes for bowel cancer if it's diagnosed in a very early stage. So important. And then finally, that leaves lung cancer. And this is quite a new screening, isn't it?
Yeah, so it started off actually with a pilot, and now that was successful. So it's being rolled out across different parts of the UK. And so it's not available in all areas yet. And the lung cancer screening programme is invited for people from the ages of 55 to 74. And it's a little bit different to the others because it starts with a chat. So you'll be identified from GP records and then receive usually a phone call where they talk through your medical history, your medications, if you have any family history, things like if you've smoked, to assess if you're high risk. If you are high risk of developing lung cancer, then you'll be invited for a GP appointment to discuss things further, and maybe even a CT scan to take some images of the lungs to pick up if anything is there.
And with all of those screenings we've just discussed, you have to be invited by the NHS. But if you are somebody who thinks you have a higher risk, can you get earlier or more frequent screenings, and how would you go about requesting that?
So if you are someone who has pre-existing conditions that increase your risk of a cancer developing, or you have a family history of a cancer, then you can chat to your GP about either having more frequent screening or starting at an earlier age. And that's individual. So I'd recommend people chat to their own doctor about that. The other thing is that if you want to access them earlier, then you can also go and have them done privately.
Okay. And I noticed that we haven't mentioned prostate cancer, which is actually the most common cancer diagnosed in men in the UK. So what can men do if they want to check for prostate cancer?
So there's no national prostate cancer screening programme, meaning not everyone's invited. And that's because with these screening tests, it's really important that we don't falsely diagnose people. And that's why it's not been rolled out. But any man over the age of 50 can go to their GP and ask for a prostate cancer check, which starts with a blood test called a PSA check, which stands for prostate specific antigen. And that's often raised in cancer. Now, it is also raised in other things. So having a raised PSA doesn't mean you have cancer, but it may mean that your doctor does further tests, maybe an examination or some further imaging and other investigations like an MRI scan. But I know lots of men are worried about having their prostate checked because they don't want to have the physical exam.
The finger up the bum. We're talking about the finger up the bum. They don't want to have that.
Exactly. First of all, again, like the smear test, it's over before you know it.
Yeah.
But there is also this blood test, which is a pretty good marker.
Yeah, I think that's a really important message, because I know a lot of men are put off going to their GP with symptoms because they fear having the finger up the bum, and they don't have to. If they don't want to, they can have the blood test, and they don't have to. It's not absolutely necessary to have that test. So most important thing is that men don't let fear of that put them off going and seeing their GP. I've actually just seen that we've got a comment in the chat about this. Ben's written, I was having some symptoms recently and went to speak to my GP. I had a PSA blood test, and honestly, it's nothing to worry about. Was in and out of the GP surgery really quickly. So often it is, I think, fear of the unknown and worries about what tests will be like that really holds people back from getting screenings or getting tests done. Do you think that the fear of finding out, or I call it FOFO, do you think that FOFO about results can concern people too?
Oh, absolutely. Yeah. I think everyone's worried that if you start digging, you might find something. But I really want to reiterate that I think that fear and that niggling feeling in your head is worse than people realise. You know, if you go and have these tests, or you go because you've got a symptom, you get the reassurance you need, and it puts that out of your mind, and then you can relax. The other thing that, if it is something to worry about, it's so much better to pick it up earlier. Earlier detection really does save lives. And so actually putting it off can make things worse down the line.
People sometimes also worry about making a fuss, don't they? They don't want to go and see the GP. They don't want to bother us. What's your views on that one?
I think it's got a lot worse after the pandemic as well, because we just hear in the news about how busy GPs are. We know it's hard to get an appointment, but this is literally a doctor's job. And I think if a symptom's important to you, or you don't necessarily have symptoms but you're worried about something, then it is important to your doctor and you will be taken seriously. And doctors either want to pick something up early, just the same that you do, or they do want to provide the reassurance. So please don't let that put you off.
Yeah, I totally reiterate that. And actually, you know, it's much less workload for us. If you come and see us then let things get worse and see us down the line. So don't let that excuse hold you back. There's often a perception that a lot of these screenings or tests are really invasive or uncomfortable. There can be cultural barriers as well, can't they? Let's talk about that a little bit.
Yeah, I actually read a stat by Joe's Cervical Cancer Trust, it's a cervical cancer charity, that women from BAME communities are a third less likely to go for screening.
Yeah.
And in fact, I think in their survey, 30% of Asian women had never been for a cervical screening. And I think there's multiple reasons for this. There's stigma associated with the tests. There is, fears of being seen by a clinician of the opposite gender. There is this sometimes cultural thing about being strong until things are really bad. And that is causing an issue. So I think we need to do more work at, increasing access to this and raising awareness, particularly for these groups, because it's not equal.
It's not. I think some of the work I've done with the breast cancer community as well, it's been really eye-opening that within the South Asian community in particular, in some languages, there's no word for breast and there's no word for cancer. And I know in the Black community as well, the C word is not meant to be mentioned because, it's so stigmatized. So a lot of work needs to be done. I think there's talking about cancer and calling cancer out. The more we talk about cancer, the more we're educated about cancer, we take cancer's power away.
Yes.
So whenever we're silent about it and hush-hush about it, we almost empower cancer. So great that we're having this conversation. Now, something which is getting a lot of attention is an exciting new development called genomic testing, which basically means looking at your DNA as an individual to see if there are any risks that are identified. So, Tim, this is really an area of expertise and something that you've been quite heavily involved in with your work at Bupa. So could you tell us how genes play a part in our cancer risk?
Certainly. I think we know that cancer is due to cell damage, basically, and there are certain genes in your body that are designed to help repair the cells, stop the cells dying too young. If you're deficient in those genes or those genes are abnormal, we call it mutated, you're at higher risk of getting cancer. And some of those genes you will be born with. They're carried down through your family. So if you look at your genetic makeup, and nowadays we can look at all of your genes, it's so much easier than it was even 10 years ago. We can look at all of your genes and we can identify those genes that suggest you might have a higher risk, not just of cancer, but also things like heart disease and diabetes as well. And what this means is you can start then to take steps to reduce the influence of those bad genes, if you want to call them that. Because obviously, and we know there's a lot of lifestyle factors involved in cancer, so you can't eradicate it completely. But if you know that you've got a high risk from your genetic makeup, you might want to start screening a little bit earlier. And there's some research come out very recently that men with a particular gene mutation are at much higher risk of getting prostate cancer and probably should start having their PSA checked considerably younger than the normal population would. And the same applies for things like breast screening if you've got certain mutations. So you can do that. You can also, if necessary, if there's a big family history of those cancers and you've got the mutation, you can even go so far as to have surgery to actually remove the breasts or the ovaries that might be affected by the cancer if you're at a really high risk of it. So again, knowledge is power. It helps you to take the necessary steps. It helps you to adjust your lifestyle. And we're going into this in leaps and bounds now. And the earlier you know this information, the better, basically. And again, it's not a big deal. Sometimes it's just a saliva test or at worst a blood test. What's really important, though, is that you know what to do with this. You have a proper conversation before you have the test, a proper conversation about the results of the test. The fact that you've got a mutation doesn't mean you're going to get cancer. The fact that you haven't got a mutation doesn't mean that you're not going to get cancer either. So it's really important that it's all done in the proper context.
So how should somebody approach that then? Because obviously now you can buy these tests online here, left, right and centre. You could do the test yourself, but then you might not have that person who's an expert to help you understand what it means. So what's the best way to approach this?
Right. You can go out and buy a spanner. That doesn't mean you can fix a Ferrari.
Exactly.
And I think that's the really important thing with this is that the test is a very small part of the process. It's really important you have a conversation with a genetics expert who will look at all of your family members as well, because these are genes that you've been born with and you've got them from somewhere in your family. So you'll have that conversation before the test. When you've had the test come back, you may find things you weren't even looking for. You might have had the test because you've got a family history, but other things will pop up. So again, you need to be able to talk to somebody about that, to understand what that means, what actions you may have to take in the future to reduce your risk of getting those diseases that have come out of the results of the test.
So who might, I guess, depending on their family history, who might be able to access this type of testing on the NHS versus who would need to go down a private path?
On the NHS, particularly if we're looking at breast cancer, if you've got a very strong history of breast cancer, If you're from certain ethnic groups, particular subsects of the Jewish faith, there is a very, very strong link.
And this is the BRCA1,
This is the
BRCA2
BRCA1, BRCA2, the Angelina Jolie gene. But what's important actually about that gene is it's also linked to prostate cancer, and it's linked to some other cancers as well, because it's one of these genes that's meant to help your cells repair. So those people will be entitled to ask for a test on the NHS. In fact, it's recommended, and certainly if you're diagnosed with breast cancer, it's recommended that you have a test to look for all of these genes anyway, because it could mean that you're at increased risk of things like ovarian cancer. It can be at increased risk of things like colon cancer and so on as well. So you've been entitled to those on the NHS. Otherwise, if you're worried, and particularly if you haven't already been diagnosed with cancer, you might have to explore paying for the test yourself. Or if you've got private health insurance, you can often get these tests once you are diagnosed to look into things a little bit further.
Okay. So I guess just to sort of summarise then, who out there would you really recommend seriously consider genomic testing?
So we've said that you've got a 1 in 2 chance of having cancer. So we all know somebody that's had cancer. But if you've got a really strong family history of cancer, particularly, if your mother and your sisters and your aunts have had breast cancer, or if your father and your brothers have had prostate cancer, or people have had more than one cancer, then those are the kinds of times I'm going to be thinking, let's have a look at what's going on in your genome. Let's do some genomic testing and let's see whether you actually have got a genetic risk, a predilection to these cancers that we can then start to do something about.
And is it if family members are diagnosed with cancer at a very young age as well? Is that another indicator?
That's another indicator. Or people who are diagnosed with 2 cancers, breast cancer, for example, if you get breast cancer on both sides, that's a real big red flag.
Yeah.
So yes, age definitely comes into it, because cancer is generally a disease of old age.
Yeah.
Because cells get damaged as they get old. So if you're younger, there's quite often another reason behind it.
Okay, thanks. Really, really, really interesting. Frankie, I'd be keen to know what are your thoughts on genomic testing and how it can best be utilised?
Well, Tim took the words right out of my mouth. I really think that knowledge is power. And I think it just allows an informed decision for people to then try and reduce their risk in other ways. So, for example, if you find that you carry a gene like the BRCA1 or BRCA2 that increases your risk of breast cancer, we know that things like smoking, having excess body weight, drinking alcohol, all increase our breast cancer risk. And so you can take steps to reduce your risk in other ways. And I think that's really useful. You can also engage in things like earlier or more regular screening. And like Tim said, have even some people choose to have preventative procedures to further reduce their risk. And that all starts with the knowledge in the first instance. What I think is really important, though, is if you're going to have the test, you need to do something with the results. Otherwise, it induces a lot of anxiety. I think it's also important to remember that it doesn't mean you're going to get the cancer. It's just a judgment and an assessment of your risk. And so lots of people who have these genes, and the genomic testing shows that to them, never end up developing the cancer. And so I think knowledge of how to use the results is really important.
Yeah. Okay. Well, thank you both so much. That was really interesting. It's been a great chat. I think this key takeaway, we must have all said it multiple times. Knowledge is power.
Yeah.
And it's power against cancer. So, attending screenings, knowing you're normal, knowing what the signs are that you're looking out for, these are all things that can help us get ahead of cancer. So don't avoid them. As you've heard, it's really important to keep up with your regular screenings. I completely understand why nerves might put you off any kind of test, but the truth is that a cancer test or screening, it's never really as scary or uncomfortable as it may seem. But cancer prevention isn't just about detection, it's also about the small choices we make in our daily lives. Now, Tim and Frankie are just heading over to our high table to show us some of the day-to-day things that can affect our cancer risk, as well as the healthy changes that can help us feel happier, fitter, and more resilient to a whole host of diseases, including cancer. So I'm going to go over and join them now. Hi, both. Tim, why do certain choices raise or lower our risk of cancer?
So essentially, cancer is caused when cells get damaged. So if you expose your cells to something they wouldn't normally meet in their natural state, there's always a risk that's going to lead to cell damage, and that cell damage, if it continues, can lead to cancer. So all kinds of things can cause that.
Okay, so it's not just about being healthy necessarily, it's about turning up or ideally turning down the damage that your cells are exposed to.
Absolutely, yeah. And there are specific things that we know cause more damage than others, and they're the ones that you really need to dial down.
Okay, so I see that you both have this array of products in front of you here. So let's talk through how these might affect people's cancer risk and what healthy swaps people can make to replace them with. Let's start with these scales, which are in front of you, Frankie. So what's that about?
Yeah, so this is all about maintaining a healthy weight. I think talking about weight's a bit of a sensitive topic. So I just want to caveat here that this is nothing to do with what you look like in your clothes. It's just to do with the amount of fat tissue you have in your body. We know that carrying too much excess fat can increase our cancer risk for two reasons. One is that fat tissue can release hormones, and that can cause cells to divide. We know that more cells divisions increase your risk of something going wrong and a cancer developing. But also carrying too much extra weight can also cause inflammation on your body, and that does the same thing, again driving cancer division and therefore increasing the risk of a cancer developing. We know that maintaining a healthy weight throughout your life reduces that cancer risk significantly. And it's not just about cancer risk, it also increases lots of your other health parameters too.
Okay, and that's in some ways linked to the next thing, which is ultra-processed food, which don't help us much either if we have too many of them.
Yeah, so much talk about ultra-processed foods. I really want to set the kind of facts straight on this, that we're not talking about all processed foods here. Some foods that we eat are processed and they're still healthy. Anything you get in a tin, like tinned vegetables, they're still processed in some way, but they're still healthy and nutritious. We're talking about the heavily or ultra-processed foods here. And these are things that are like our convenience foods, those ready to eat or ready to heat meals. Now, the reason that these can increase our cancer risk is twofold. One is that they have a lot of extra sugar and additives, and they lack a lot of fiber. And that can mean that it's really hard to stabilize our blood sugar levels. So often when we eat these foods, we get a blood sugar spike, then it drops and it leaves us hungry shortly after. And over time, constantly eating these foods and letting them have a large proportion in our diet can mean it's quite hard to maintain a healthy weight, and that weight gradually creeps up. The second is that, as I mentioned, they lack fibre, and we know that eating enough fibre is protective against many bowel cancers, particularly bowel cancer. And the third is that often some of the additives and preservatives that we find in these foods can also cause kind of irritation and inflammation to our cells, particularly the cells of our intestines where we digest our food. And we know that chronic inflammation and irritation, again, can increase cancer risk. So it's a complex process. I'm not saying that we have to cut these foods out completely. I think that's really unrealistic for many people. It's just that we have to think about how much of our diet is these ultra-processed foods.
Yeah, I mean, we've got some crisps here representing our ultra-processed foods, but absolutely not going to get cancer from eating just a packet of crisps.
No, you've got to look at your whole diet, as a whole over the weeks or months. I think if you are eating a diet that is rich in the protective things, things like whole grains, whole foods, fruit and vegetables, lots of fresh ingredients, and then you eat some ultra-processed foods, it's kind of like a needle in a haystack. We've got to look at the diet as a whole and not kind of demonize one individual food.
Speaking of fruit and vegetables, that's what we've got next on our lovely table. Some bright, colourful variety of fruit and veggies there. So these are a great alternative to ultra-processed foods. How can these help us?
So the foods that we've got here are plant-based foods, they're whole foods. Foods like fruit and veg or whole grains, things like fresh herbs, nuts, seeds, all these kind of things are really actually protective against developing cancer for a number of reasons. One is that they contain lots of fibre, which we know is protective and it keeps the lining of our intestine healthy. The second is that it's a lot easier to maintain a healthy weight if a large proportion of your diet is whole foods. They keep us fuller for longer. They don't cause those blood sugar spikes. They also don't contain lots of, additives and preservatives and things. And so, again, the majority of our diet should look like this, but there's always a small place for the soul foods.
Yeah, absolutely, because food is joy as well as nutrition.
Yeah.
What about when it comes to food and, cancer curing? Are there any superfoods or foods that can cure cancer?
I know. I would love to say that was true. I get asked a lot about this in clinic, like what can I eat to reduce my cancer risk, or even if you've got cancer, improve it. Unfortunately, I think food is really important for our long-term health. We know what we eat influences our long-term health risk, but food isn't medicine. And so it's not as simple as eat one food and it's going to completely change your cancer risk. I think we have to look at our dietary patterns over our life. We know that foods rich in fibre do reduce our risk of bowel cancer. We know that heavily processed foods, particularly the processed red meats, are linked to increased risk of bowel cancer. And actually some new evidence over the last couple of years is that a diet that has dairy products in and getting that extra calcium can also be protective against bowel cancer. So I think diet definitely has a place on a lot of our health parameters, but it's not as kind of blunt as one food cures cancer.
No, and it's certainly not going to be in place of medications and cancer therapies that are proven and evidence-based. Now, the next thing on our table is trainers, and I'm guessing that indicates something that both you and I, Frankie, are very passionate about: exercise, physical activity, movement, whatever you want to call it.
I think if exercise were a drug, it would be the most widely prescribed drug of all time. I really don't think we talk about the benefits of exercise enough. Lots of people get into exercise because we want to change the way our body looks, or we want to just get a little bit fitter. But actually, I can't name a single disease, health parameter, or even cancer that regular exercise isn't protective against. We know that regular exercise reduces our risk in the long term of developing cancer. And that looks different on everyone. For me, that might be going out on a run. For you, it might be going and lifting weights in the gym. For someone else, it might be taking the dog for a walk or doing some gardening and getting your heart rate up. Yeah. I think the takeaway message is that all forms of movement count, and it's better to do something consistently over time and keep up with it, a form of exercise you enjoy, to reduce your long-term cancer risk.
And I think walking is something that tends to be the most accessible thing to many people if they're looking for something to start out with, and ideally if you can walk in nature, because it's also great for your mental health as well.
Absolutely.
Okay, brilliant. Tim, you've got something very interesting in front of you as well. So I can see a cigarette packet there. Yes, most people kind of know this one, don't they?
I get all the bad stuff. Yes, I mean, we know that smoking is probably the single biggest identifiable cause of cancer. There's no two ways about it. Tobacco, when you smoke it, contains 70 or so carcinogens. These are substances that damage your cells and can lead to cancer. And it's not just lung cancer, which is what people immediately think of. Yeah. It can cause other cancers: mouth cancer, throat cancer, lots of other things, stomach cancer. So, yeah, they're bad for you. We know that. They're unpleasant. Also, they're very, very addictive, and that's the big issue. So what we can do about it is what we have here. We've got some nicotine patches and some nicotine gum, because nicotine is the addictive part of the cigarette. And if you really want to stop smoking, but you just cannot resist the urge, then some form of nicotine substitution will enable you to get that nicotine hit that you crave without the 70 or so carcinogens going into your system. Nicotine isn't 100% harmless itself, but it's a heck of a lot better for you than cigarette smoking. And it can be used to get you off of the smoking altogether. And you have to remember, of course, smoking causes heart disease, smoking causes strokes, smoking causes other things as well as cancer.
Yeah, so the single most important thing any smoker can do for their health is to quit tobacco. And if using a nicotine replacement helps, then go for it. We've got something else here, which is another kind of healthy swap: alcohol-free beer. So why does alcohol increase your cancer risk?
Alcohol, again, it damages cells. If you think about it, you can preserve food in alcohol. How do you preserve it? Well, you damage the cells, so they change. And that's what happens when you drink alcohol. And it's been shown, interestingly, it's a very big risk factor in breast cancer, which is something I didn't know until quite recently.
Yeah. The
good news is alcohol-free drinks, particularly alcohol-free beer, is very much better than it used to be. And I can attest to this.
Me too.
Perfectly drinkable, lovely stuff, and you don't suffer for it in the morning. So if you can stop alcohol altogether, there is no safe amount of alcohol, but you can reduce it down to infrequently. Certainly stick within the government guidelines. Don't drink on more than 3 days a week. Don't binge drink. But if you can find an acceptable substitute, and alcohol-free drinks nowadays are actually very good.
And I mean, one of the things I often talk about is actually going to the pub can be really good for your health because that's social interaction. And now they can pull a pint of alcohol or very, very low alcohol beer, which is kind of the whole experience. Being British, you need to have a pint in a pub, don't you?
Oh, definitely. It's a big social event as well.
You can have the benefits without the harms.
And your darts will be better.
And your pool or snooker. Are there some types of alcohol that are better or worse for you than others?
There's no safe form of alcohol. You could argue that for things like cancer of the esophagus and mouth cancer, then maybe strong spirits are worse because you're just putting more alcohol into that area of your body. But all forms of alcohol increase your risk of cancer. There is no specific safe form of alcohol, no.
Okay, that's really good. Now, the next thing that we've got here in front of us is some tanning oil and tanning products. And I don't think we're really talking about whether these increase or lower your risk of cancer, but it reminds us to talk about the big ball of fire in the sky.
Yeah, sun exposure generally. And again, it's the same reason. When you go out into the sun, your skin initially starts to feel warm, then it starts to go a bit red. And if you stay out in the sun, it starts to go brown. And people used to think, well, that's brilliant. That's a great sign. But that's actually a sign that your cells are getting damaged. And one way of protecting themselves is to get darker, because that actually, it stops the sun going through the deeper layers of skin.
So the tan is evidence of damage occurring to the cells?
Absolutely. Yeah, totally. And that damage can be irreversible. It can lead to melanoma skin cancer, which is one of the commonest forms of cancer in warmer countries, but becoming much and much more common in this country as well. And that's not just down to the sun, that's down to tanning beds as well, because we don't always have a lot of sun in this country, so people go down the tanning salon instead. But it's the ultraviolet light that causes the problem. The ultraviolet light in a tanning bed can be much stronger than going out in the midday sun in the summer without even realising it. And nowadays, if you want that healthy glow, as we used to call it, fake tan products are just as good as sprays. Yes, go the full Strictly. A spray tan is just as good if that is your vote. But really, keep out of the sun. If you must go out in the sun, if you work out of doors, factor 50 if you possibly can. Certainly factor 30 plus. Cover up, put on a hat, put on a t-shirt.
Okay. Well, I think that's the good thing about this one, is it is easy to protect ourselves with these products. And as they say, the only safe tan is that out of a bottle.
Yep.
Do these risk reducers matter more at a certain age, Tim?
I think obviously the greater the period of your life when you're not exposed to these risks, the better.
Yeah.
So the earlier you can do it, that's obviously going to be better for you. But they work at any time of life. Stopping smoking, within half an hour of stopping smoking, your risk of heart disease goes down.
Wow. Within half an hour?
You get more oxygen to your blood.
Yeah.
And the risk of other vascular diseases will go down over a greater period of time. Your risk of lung cancer will start to go down straight away. Might take years until it's back to normal. It depends on how long you've been smoking for. With alcohol, if you've damaged your liver, as soon as you stop drinking, your liver can start to recover. And that liver damage can lead to liver cancer, which is something that people tend not to think of. So any of these things, really, the sooner you can start them, the better.
Finally, one last question for each of you on this before we move on to our audience Q&A. What is the one piece of advice that you give to our viewers to help them get ahead of cancer, Tim?
If you ignore it, it won't go away. So seek advice.
It's a really good one. Thank you. Frankie?
I think mine is that, a bit like what you said, it's never too late to start these healthy habits. We know that changing your diet or starting exercise, even in your 40s, 50s, 60s, does make a difference to your life expectancy and to your cancer risk. And what I would say is, if you take up these habits and you still develop cancer, your outcomes from that cancer are also going to be better. There was a great study that came out earlier this year that showed people with bowel cancer who engage in a structured exercise program after their surgery live 30% longer. And so even if you do get that cancer diagnosis, which many people unfortunately will, having all these healthy behaviours like exercise, good nutrition is still going to help. So it's just never too late.
And I think one final caveat that I'll add to this is, I know some people get cancer and then they blame themselves, they feel guilt, but you shouldn't, because whilst lifestyle is important, it's not the reason you get cancer. You know, your genetics play a big role. So much of it is outside of your control. So we don't want people to go away feeling like that.
Yeah.
So obviously no one can predict the future, which is why none of the things we've mentioned should make you live your life in fear or sacrifice the things you love. I'll be having a few crisps later. It's just that gently nudging the scale in your favour and finding something that's sustainable, that works for you. Now on to the most important part of Inside Health, which is your questions. You've sent in loads of things on the chat, which is brilliant, so thank you. And as always, we'll do our best to get through as many as we can. So let's start with this one. Frankie, first question's for you, and this one is about avoidance, really. I've noticed my partner's got a mole on his arm that's getting bigger, but he keeps forgetting or saying he's too busy to get it checked. How can I make him go?
Oh, it's so common. I think firstly, having an open communication about, you know, it's not just about their health, it's also about your internal worries, and that them not going and then putting off is also affecting you, because I think, you know, any partner also wants to care for your well-being as well. I think you can also practically offer to, you know, help make the appointment, call up the GP and make the appointment for them, just to take that barrier away, or offer to go with them to support them through the appointment. And one thing particular for this question about the skin checks is that you can also do an e-consultation. So now at many surgeries, you can take a photo, submit it online, and that makes it a lot easier to do. It's not like you have to take your time off work or sit on the phone on hold anymore. So I think those things, and just kind of sharing how you're feeling.
Yeah, I mean, so many men sit in front of me and apologise for being there and say, my wife booked this appointment for me and made me come, and then often it's there, well, thank goodness that she did.
Yeah.
Tim, this person is asking about those lung cancer symptoms that we mentioned. I've got a smoker's cough, but how do I tell if it's something more serious like lung cancer?
People talk about a smoker's cough as if it's something normal. A smoker's cough is a sign that your lungs are damaged, that they're not able to clear away the mucus, and that you have to cough that mucus out. If that cough is getting worse, if you're starting to cough up blood, if you're getting pain when you breathe or pain when you cough, those are all signs that you really should be looking into it a little bit further and seeking advice. If you're losing weight, I think a smoker's cough is not a normal phenomenon. It's something that smokers get, but non-smokers don't get it. So that in itself is a sign of lung damage. You just need to be extra tuned into those other things that should be making you maybe go and get a little bit of advice.
Yeah, and if in doubt, just go and see your GP and just share that concern and responsibility with them. Tim, I think this one's for you as well. My mum, dad and uncle have all had cancer. They're in remission, but it's got me worried about what's going to happen to me. Can I do anything to lower inherited cancer risk?
You can't do anything to lower your inherited cancer risk, but the first thing you can do is try and find out if you've got an inherited cancer risk. Because 1 in 2 of us will be affected by cancer at some point in our lifetime, and it may just be you've got a big family and these are all a series of random events. Probably unlikely when it's that many. So look into getting your genetic history examined first by talking to a geneticist. Look at what the cancers were. How old were your family members when they got them? Was your granddad a really heavy smoker? That's why he got lung cancer, and you've never smoked. Makes it much less likely that you'll get it. Yeah. And then if necessary, they will advise whether you need to have a genetic test. That will look at your genes and see whether you've got any mutations that might increase your risk of having cancer. If you have, doesn't mean you're going to get it, doesn't mean you're more likely to get it, but it gives you the chance to address some of the lifestyle issues that we've discussed and do the best you can to modify all of your other risk factors. But again, I think the most important thing is put your mind at rest by getting advice and a proper examination and opinion, and then go on from there.
Comes back to what we've all said so many times, doesn't it? Knowledge is power.
Yeah.
Frankie, this one's for you. This person says, I have small breasts and no visible issues. Do I still need to bother with a mammogram?
Well, the first thing to unpick there is the comment of no visible issues. Obviously, the mammogram is part of breast cancer screening, and the whole point of this is for people who have no symptoms yet, but no visible issues. So first of all, that reason absolutely should still go. The second is that the size of the breast doesn't make a difference to your breast cancer risk. It's just the presence of breast tissue or not, which is why some breast cancers also occur in men. So size doesn't increase your breast cancer risk, so absolutely should still go to the mammograms as normal.
Absolutely, thanks for that. And this is something that I think can be a real concern for a lot of people. For you, Tim, I didn't live a particularly healthy life when I was younger, smoking, binge drinking, that kind of thing. Can I still reduce my risk of cancer, or is the damage done?
Inevitably, yes, a certain amount of damage will be done. But the body is incredibly resilient, and it can bounce back and it can recover. So it's never too late to start addressing those issues. Living the healthier lifestyle, stopping the smoking will rapidly reduce your risk of illnesses other than cancer, and it will gradually reduce your risk of cancer. Cutting down on the binge drinking, your liver is amazing. It can recover incredibly rapidly, so that will ease the damage on your liver and it'll enable other organs to recover. So no, it's never too late to change your lifestyle.
What's done is done. But what goes forwards is down to you, isn't it? It's down to us. Thank you so much. Those are unfortunately all the questions that we have time for today, but a huge thank you both to our guests and to all of you for watching. Early action really is the best path to getting ahead of cancer. So it's worth remembering those 3 things that we've been through in this episode. Firstly, knowing you're normal and when to take action. Getting comfortable with tests and screenings, and lowering your risk with realistic lifestyle choices. If you want to find out more about cancer, you can head to the Bupa website. There are lots of resources and articles on there that will be really helpful for you. We'll also be putting a link to a very quick survey in the chat. This helps us make sure Inside Health is as useful as possible for you. So we'd really love your input on that. Thank you again for watching, and we'll see you next time. Take care.